Hey there, welcome back to the show. Today we have a very special guest with us to talk all about oral health and your hormones. And believe it or not, there is a connection. Amber White is a dedicated dental hygienist and holistic health practitioner who found her true calling in biological dentistry. After years of practicing traditional dental hygiene, Amber sought to offer more comprehensive care for her patients and clients, leading her to discover the profound connection between oral health and overall systemic wellness. Her passion for deeper patient care and holistic healing drove her to explore functional medicine, enabling her to make a more significant impact on the health journeys of those she serves. In addition to her clinical work, Amber guides dentists in their transition to biological dentistry, helping them integrate holistic practices. She also collaborates with health and wellness professionals, empowering them to incorporate oral systemic health into their protocols. Amber has advanced her expertise through studies with the American College of Integrative Medicine and Dentistry and earned hormone certifications from the Institute for Integrative Nutrition. Today, she's committed to educating others on the importance of holistic health and guiding practitioners in transforming their approach to patient care. Welcome, Amber.
Thank you, Claudia. Thanks so much for having me. That was a lot.
Yeah, well, you're accomplished and you're doing a lot. So I'm excited to have this conversation because oral health is yet another thing that is affected by the hormone changes that are happening in perimenopause.
It definitely is. There's such a connection between oral health and our hormones, and there's so many things that we can do to proactively really balance everything, balance our oral microbiome and balance our hormones. A lot of the things we talk about with perimenopause, can be really stressful and negative things that happen to our bodies, but there's so many things that we can do to proactively support our body in the process and feel our best.
Yes, I agree. So can you just go into like a little bit of what the connection is between oral health and hormones specifically?
Yeah. Really, I think I just want to start a little bit back is our mouth is connected to everything in our body, and we've really been treating it in isolation for a long time. So everything that happens in our mouth does have a direct impact on all of the systems of our body and vice versa. And so hormones are not an exception. Our gum tissue, our bone structure, the periodontal ligament, which is a ligament that surrounds our teeth, these all contain hormone receptors. So when our hormones fluctuate during different times of our cycle, different times of our life, as women, we see so many changes in our oral tissues, in our teeth, in our gum health, in our bone. So it's really all connected.
Mhm. Yes. So, as you know, this is perimenopause simplified. We try to simplify perimenopause, even though it's not very simple. We do our best. So, how does perimenopause specifically start to affect your oral health? And I know that's kind of a multifaceted question. So,
Yeah. So, when we see perimenopause, a lot of times we'll see this decline in estrogen.
mhm.
Estrogen is something that is going to regulate the blood flow to our gum tissue. So, when we see a decrease in estrogen, we see an increase in inflammation, bleeding response in our mouth. We also see a decrease in estrogen. Also see a breakdown of the support structure of our teeth, which is the surrounding bone, our jawbone. We start to lose minerals and density to our bone when estrogen decreases. Progesterone, conversely, when we see an increase in progesterone, we'll see more bleeding gums. So it's really about these fluctuations in our hormones that we see things like gum disease, periodontal disease, increased risk of cavities, increased risk of different diseases and inflammation in our mouth. So hopefully that, kind of, it's not a simple topic. So
No.
it's like a very complex topic, but there's so many changes that are happening through this time in our life, and it's how can we support our body to bring balance back to these systems and hormones.
It's just like it's funny to not funny to hear, but it's just like I said earlier, it's like another thing that is impacted by our hormones. And yet I would venture to say that most women that are going to their dentist are not hearing anything about their hormones and peri or menopause and that how that can play a role in it.
Absolutely. I think I I would say probably the majority of dental professionals aren't really talking about this topic because there really isn't a great source to get all of this information in one place.
Mm.
You really have to dive into the research and you really have to start to understand, how these connections are being made. The science is there and the information is there. It's just not easily accessible to dental professionals across the board. I think, of course, in biological dentistry, we're always looking to dig deeper, learn more, but it's also a very niche topic that
Mhm.
even some of biological dentists haven't ventured down this path yet. So it's just one of those things that really have to become your own advocate and really understand for yourself. So hopefully these conversations can bring more awareness to the forefront.
Yeah, that is certainly my goal in bringing somebody like you on because, yeah, and I don't fault, dentists or any professional because they go to school for whatever it is that they want to go to school for and they become experts in a certain area. And the curriculum just isn't there for a lot of them. And like you say, unless they really go for further schooling and are doing a deep dive, they're not going to have this knowledge. And many of them just don't know what they don't know. So somebody like you're really special in my opinion because you have done the work. You have gone above and beyond to do the research and put two and two together. And of course, I always say like the body is not separate. Like it's all connected. And in conventional medicine, unfortunately, many times they're not looking at it in that way. It's always isolated, like you said earlier. So I love this conversation, especially because as you know, once we start to lose hormones, we are at risk for chronic diseases. And somebody like myself, we often talk about things like diabetes and heart disease and cancers and things like that. But what are some diseases of the mouth that are happening that you're seeing that? And then we can talk about what are some action steps that we could really start to take.
Yeah, definitely. So when we look inside the mouth, one of the things that we're really looking for is chronic low-grade inflammation. It's
Mhm.
one of the biggest drivers of disease in the body. So when we think of that, we think of gum disease, which affects the gum tissue. And then as that progresses and advances, it becomes periodontal disease, which starts to take over our surrounding bone and our ligament and the support structure of our teeth. That's really, really common. About 50% of the population has some form of gum disease. And as we get older, that, increases. That is something that we see very commonly and very linked to perimenopause as well. Because, like I was saying, when these hormones fluctuate, we see this increase in inflammation and increase in blood flow to the tissues in our mouth. The other things that we see are cavities. And so, when we think of a decrease in salivary flow, our saliva not only helps to cleanse our mouth, cleanse our teeth, but it also has a buffer capacity that helps us stabilize the pH of our saliva. So a drier mouth is also more acidic. So we have an increased risk of getting cavities when we have dry tissues and we have an acidic environment.
Mhm.
We also think of infections. When we have a decrease in estrogen, we have delayed healing responses. Like when you're saying diabetes, that's another thing, like delayed healing responses. So you're more prone to infection. So if we do have gum disease where the gum tissue is inflamed, it's now created this pocket where bacteria can travel between the tooth and the gum into the bloodstream.
Mhm.
And so that's where we're going to see more systemic imbalance as well. We also see an increase of oral bacteria when we have a decrease in estrogen. We call it the oral microbiome. It's really this balance of bacteria. And there are some that are good that we really need, and then there are some that are harmful and opportunistic. So when we
Mhm.
have that decrease in estrogen, we see this rise in opportunistic and more harmful bacteria. So it's really trying to keep balance of the oral microbiome at the same time.
We kind of scratch the surface, I guess you could say, when it comes to our clients and their oral health. Obviously, we're talking about hormones, we're talking about the changes that are happening in perimenopause, the food and lifestyle changes to make, preventative practices. But something we do focus on a lot is gut health. And we often tell our clients that that starts in your mouth. And there are some strains of bacteria that are harmful that we're swallowing all day long. And if your gut is not optimal, your gut health, then you're going to end up with these overgrowths or gut infections and whatnot, pathogens. So I want to go back to a little bit like the dry mouth that's happening. Can you give a couple of pointers as to how to improve dry mouth in this stage of life?
Absolutely. So, dry mouth can happen for a few different reasons. So, it's important to understand the source. Medications a lot of time can cause dry mouth, so we would definitely wanna take a look at your medical history and kind of see why this is happening, but if it's hormonal related, which we very often see, we really wanna make sure we're hydrating,
Mm,
and of course, I know you talk about hydrating on a cellular level and getting minerals in your water, not just, plain water, so things like bone broth and adding minerals to your water are great. The other thing that we can do is red light therapy is great
mm,
for stimulating saliva production. So you can actually aim the red light at your salivary glands, so they're right underneath your tongue, and that
mhm,
can help to stimulate saliva response, increasing that saliva. The other thing that we think about when we think about dry mouth is our nervous system. And
mhm.
so we know the fight or flight, rest and digest. Rest and digest is when we are stimulating saliva response in our mouth. So really doing things that are going to help to activate your parasympathetic nervous system are going to be really beneficial for stimulating your saliva flow as well.
What isn't it good for?
What is it
Right?
good for?
Oh, nervous system support. My goodness. Yeah, we all need it, myself included. I want to just go back to the red light therapy because I know, that's one of the biohacking tools that women hear. They're like, oh, I got to go get myself a red light. I often will sit in front of it, often for thyroid support. So the
Yeah.
fact that you're saying that also under your tongue. So do you literally sit in front of it and kind of like just in front of it? Do you lift your tongue up?
Yeah, you can sit in front of it. There are wands that you can use. They might be
Okay.
easier inside the mouth,
Yeah.
where you can actually shine it right underneath your tongue. We also
Okay.
have salivary glands in our cheeks, so we
Hmm.
can like place it towards there as well. And it's also going to help with inflammation and stimulating that cell turnover. So it's helpful not just for salivary flow, but for really supporting that inflammation response as well.
Wow. So if somebody has like bleeding in their gums, if they ever have pain, say from like wisdom teeth being extracted, which we can talk about in a second, that is considered inflammation. So that is when that would be beneficial.
That would be perfect to use after any dental surgery. You can shine that right outside of your face, like you were saying you do for your thyroid, placing it on the side where you had that surgery. That's going to be really beneficial for stimulating that healing response and really expediting that healing response. For dry mouth, I just wanted to mention is, oil pulling. So
Hmm.
using coconut oil and swishing with that, I personally like to mix a little bit of aloe vera juice with the coconut oil and swish that because that's gonna really hydrate the mouth, but also bring down that inflammation as well.
Okay. So coconut oil mixed with aloe vera juice. And is that something that you would recommend on a daily basis? Is that safe to do
I
daily or a
I
couple
would
times a week?
I'd probably do it a couple times a week. Coconut oil is naturally antibacterial, and when we talk about keeping the balance of bacteria, we really don't wanna wipe everything out, so we just
Mhm.
have to be careful. So 2 to 3 times a week, rinsing with or oil pulling with the coconut oil would be perfect.
Okay.
And
I'm
then
going
you
to
can
start
always
doing that.
add in yeah, you can add in a probiotic, so it's helping
Hmm.
to reintroduce some of the beneficial strains of bacteria as you're, lowering the levels of the opportunistic, more harmful bacteria.
Okay, one that's specific to oral,
Yes,
the oral
yeah,
microbiome.
yeah,
Okay,
and there's some good ones,
okay,
yeah.
great. A lot of people have their wisdom teeth removed or root canals or whatever, like teeth extractions. And can you speak a little bit to how that affects us long term and how sometimes it can be detrimental?
Yeah, so this is a really big topic. Definitely one of the topics that's a little heavier in
Hmm.
biological dentistry because there are some differing viewpoints and philosophies in regards to this. But when we really focus on hormonal health and what's happening with the bone and the cell turnover there, there's a few things that are really important. Number one, I think wisdom teeth kind of have been given this blanketed approach of everybody needs their wisdom teeth out, and that's really not necessarily the case. Before getting your wisdom teeth out, it's really important to have a really thorough evaluation. And there's an x ray that's called a cone beam x ray, it's 3D. And having that done with someone that can interpret that, having that done with a dentist, is going to allow you to know if you actually do need to have your wisdom teeth removed. And there are reasons too, whether they are infected, they're affecting teeth adjacent teeth, the teeth in front of it. There's different reasons why they might be extracted. So that's a conversation to have with your dentist. But when they are extracted, it's important to follow biological principles and make sure the healing response is working. There's a lot of factors to that. For women, when our hormones are fluctuating, we are more likely to heal more slowly.
Mm,
And so when we're more likely to heal more slowly, we're more likely to develop something called a dry socket,
mhm,
which would be an area where it's non-healing bone. And oftentimes when we think about this term that may be new to a lot of people, it's called a cavitation.
mhm,
So basically, if we think about a cavity is really a hole that's starting to form in your tooth where it's become demineralized, and it's really starting to break down. A cavitation is a non-healing hole in your bone. It can heal over, but there can be a void in your bone that's non-healing. And this is a site where there's not energy flow to the bone, there's not blood flow to the bone, and it's a site that can harbor bacteria. And that's something that a biological dentist can evaluate for as well. This doesn't happen to everybody, but something that I think a lot of people don't realize is when you are on hormonal birth control, you're actually 2 times more likely to develop a dry socket.
wow.
So we know when we're our hormones are, out of balance or we have like this increase in progesterone, we're more likely to have a non-healing area of bone. So it's just really
Mhm,
important to do all of the things that can stimulate your healing response. So a biological dentist, if they are removing a wisdom tooth, they are going to actually draw your blood, spin it down, and remove your stem cells. It's
wow.
called PRF, and they're going to place it back in your healing site to really stimulate that bone regeneration. The other thing that they're going to do is before they place that PRF, they're going to clean the site with ozone, which
Mhm,
is natural. They use it as gas or water in this case. And they're going to use that to really remove all of the infection, all of the bacteria, and really get a solid healing site for this extraction. And then the red light therapy would be amazing to use after that. Of course, we want to like think about nutrition and making sure we're getting those fat soluble vitamins and there's so many things to think about there, but hopefully that answered your question.
It did above and
Okay.
beyond. Thank you.
Okay.
No, it's a complicated topic, obviously, and there's so many different things, because especially because, you go to your regular dentist and you think you're doing all the things right by going for your cleaning twice a year and getting your x-rays and all that, which let's talk about x-rays next. But there's so much more to it. And like I said earlier, the body, there's so many different moving parts, and we really do have to think about our stress. We have to think about the foods that we're eating, how we chew our food, the quality of our saliva, and then of course even the products that we're using. A lot of people, they go to their dentist for their cleaning every year or twice a year, and they're sent home with certain toothpaste or mouthwash. And I love to talk about that with you because I know there's certain products and brands that you are more aligned with, just because of the quality and the ingredients that are used. So let's talk about that. Let's talk about like products that women are typically using, and maybe what are some steps to kind of switch over.
Yeah, absolutely. So dentistry is definitely one of those areas that endocrine disruptors are all
Hmm.
over the place. And, it goes from the materials that are placed in the mouth, but also, the products that we're using at home. And so we really want to look at our ingredient labels and we want to remove fluoride. You had mentioned the thyroid. Fluoride inhibits thyroid function. We
Hmm.
really want to get that out of the routine. There's also some ingredients that you'll see on labels, SLS, triclosan, parabens, all
Hmm.
these different things. So we really want to take an inventory of what we're using and swap out some products. Some products that I like to use a toothpaste that has hydroxyapatite. I do kind of want to highlight that in a perfect world, when our mouth is functioning optimally, the toothpaste that we use really shouldn't matter because
Hmm.
our mouth actually has a natural demineralization and remineralization process. Uh,
Hmm.
but when we are more prone to cavities, we want to use something that is remineralizing that's going to support that process for us. So something with hydroxyapatite, and there's a lot of really good ones out there. I like Super Teeth, Dr.
Mhm.
Jen's, Fig has one. There's a lot of good ones. Someone that's not necessarily prone to cavities, but is more prone to inflammation and gum disease, there's a product called Revitin, a
Mhm.
toothpaste that has CoQ10, vitamin C, all these ingredients that are going to help reduce the inflammation. As far as floss goes, a lot of the traditional floss does contain phthalates and BPA, so we want to use something that is clean, organic. So I recommend Cocoa Floss for that, and that one's my favorite. As far as rinses go, Listerine, the most
Mm.
popular is if you have it, throw it out. I'm sorry,
Yes, please.
sorry, Listerine, but it's
Mhm.
damaging to our oral health. It's damaging to our oral microbiome. It affects so many things. A product that I love is called Stella Life. It's a homeopathic mouth rinse.
Mhm.
And that is one that is really great for women in perimenopause. It's going to introduce some of these natural ingredients, reduce inflammation. I think it's
Okay.
great to have on hand for anyone. And that also, as we were talking about different oral surgeries and things like that, that's a great one that's healing and it also has an analgesic effect, so it's going to like reduce pain. So if
Okay.
you are someone that has sensitivity, the other thing that can be really beneficial to use is ozone oil. So I
Mhm.
talked a little bit about that antibacterial effects of ozone, also as antifungal, antimicrobial, antiparasitic. So anyone that has periodontal disease where they have more of an inflammation or they have, the hygienist probably tells you you have deeper pocketing around your teeth. You can use the ozone oil and place it below the gum line, and that's going to really help to reduce that pocket depth for you and bring down the inflammation. A tongue scraper. Everybody
Mhm.
should be using a tongue scraper. That's first thing in the morning. Um, that's a really great product to use. And like I said, I like oil pulling. I like to add the aloe vera to that. Those are really my favorite, my go-tos.
Yeah. Okay. I want to go back to the x-ray question because that is something that, obviously we're told to go for x-rays however many times, not typically a year, but maybe it's every couple of years. So what are your thoughts on that? When is it necessary? When is it not necessary?
Yeah. X-rays are really important tools because we can see things far before they'll be visible to the naked eye.
Mm.
So it is really important to get X-rays, but it's also really important to understand why and personalize that recommendation. So, a lot of dental offices will kind of generalize the recommendation where you get something called bite wing x-rays, which
Hmm.
are two photos on each side. You get that once a year. You get the full series of x-rays every 3 to 5 years. And really, those recommendations are based on your dental insurance policy, what they allow.
Hmm.
And that's not really taking the patient into account. So, if you are someone that is prone to cavities, you're getting them frequently, of course, we want to get to the root cause of why. But if this has been your history, if you do have advanced gum disease, anything like that, we do want to take those x rays probably once a year. If you are someone that hasn't had a cavity in 10 years and you have good oral health, we can definitely push that out further. And of course, you're going to have these conversations with your dental team. I can't give specific guidance, but you could definitely go over 2 years having dental x-rays if you really haven't had any type of disease process in your mouth in a very long time. Like I said, they are a necessary tool. They do help us to, help dentists to diagnose, help us to evaluate your bone levels. And we know when we're in perimenopause, we are prone to losing bones. We really want to be able to see that progression. So I do think in perimenopause, if we are someone that does have advanced periodontal disease, we want to monitor that.
Yeah.
And that's going to be a diagnostic tool. There are things that you can do to support your body around that time of x-ray exposure, which I like a homeopathic remedy. It's from Pecana. It's called Radinax. You can take that leading up to having your x-rays and even after to help your body detox the radiation. Also, things like chlorophyll, vitamin C, these different
Mhm.
things. We're exposed to radiation all the time, especially if we're traveling a lot, things like that. So these are great things to incorporate into any kind of exposure. But really, I think the key to it is making sure it's personalized to you and it's not just this broad recommendation.
Yeah. That's a good reminder about taking some things preventatively with x-rays and the fact that yes, we are exposed to radiation all the time and unfortunately it's not that easy to avoid.
Right.
So we can just take some measures to help support our bodies during all of that. Okay, so this was an awesome conversation, but I want to just kind of review some of the practical action steps that women can take right now. So kind of like a higher level in regards to x-rays, looking into biological dentistry, and then let's talk about some things that women can do on a daily basis to really support their oral health.
Yeah. So if we're talking big picture, if you've had dental work, if you've had teeth extracted, if you've had cavities, having a consultation with a biological dentist is going to really be able to evaluate everything. Like I mentioned right before I was talking about the products, also, the materials that are placed in our mouth have an impact on
Mm,
our hormones. So, looking for things like mercury fillings, root canal teeth, the cavitations we were talking about, mixed metals, a lot of different materials contain things like nickel, which we know, women are more susceptible to having a allergic reaction to nickel. So,
mhm.
it's really looking at what our body can handle, like what our threshold is, but also looking at what's contributing to disease in our body and imbalance. So I think that is one of the big things that we can do kind of globally is get that evaluation to see where we're at and come up with a plan to bring balance back to our mouth.
Can I ask about mercury before we get into the practical daily
Uh,
steps? So, a lot of women, especially obviously in their 40s, they come to us and they have the amalgam fillings. I
yeah,
had them myself and I had them removed via the smart removal. A lot of women don't know what that is. So, can you speak to that and why it's important to find a qualified dentist to remove those properly?
absolutely. So the smart removal, it stands for the safe mercury amalgam removal technique. So those they've been called silver fillings, the darker fillings in your teeth, they do contain about 50% elemental mercury. We know mercury is a completely toxic substance. It's a
Mhm.
neurotoxin, it's an endocrine disruptor. It's everything we don't want inside of our, our mouth.
Right.
Um, and we also know that there's 2 times that we're exposed to the most mercury vapor. So that's when those fillings were placed, probably when you're about 12 years old and they're still in there. But also the second time that we're exposed is when they're removed. We are also exposed to low levels of mercury vapor all the time they're in our mouth as we're biting,
Wow.
clenching, chewing, hot, cold, all of that. But when they're removed, it's really important that it's done safely, following that SMART protocol, because we want to make sure you are not reabsorbing the mercury vapor because it does have an affinity for your tissues. It has an affinity for your thyroid. It has an
Mhm.
affinity for your brain. So it's really
Mhm.
making sure that it's being done safely. So there's a very specific protocol where I'm sure you are covered head to toe. There's a rubber dam. The
Mhm.
tooth is treated. There's lots of water. You're doing different supplements to help remove the mercury from your body. So it's a very detailed process. So if you are going to have them out, I definitely recommend doing it with a biological dentist who is going to follow that protocol because if you are doing it unsafely where they're not using that preparation, you are exposed to that vapor. And like I
Mhm.
said, it does have the affinity to store back and recirculate in the body and can cause more harm than good. So,
Yeah, thank you for explaining that because we do have some clients who they'll say things like, "Oh, well, I had mine removed," and I'll ask like, "Oh, well, how did you have it removed? And did they use XYZ or did they do any sort of detox protocol?" And they're like, "No," and I'm like, "Oh no,"
right.
and you don't want to, of course, scare them or anything. It's always about education and teaching women how to do better. And when we know better, obviously we do better. And sometimes it is looking outside of the doctor that you've been going to for years for certain things. And they may be wonderful and they may have been really helpful to you, but they may not be looking at your oral health comprehensively and seeing the connection between your hormones and your other symptoms that are going on in your body. So thank you for that. So what are some like I kind of want to know your routine. What do you do every day? And then I feel like that can kind of help women understand what are some things that they can do daily as well.
Sure. So I personally like to kind of create it as my time. It's like a little ritual for me. We have like our
Hmm.
skincare regimen. So
Yep.
I will put on either like a guided meditation or I'll put on binaural beats or something and have some kind of calming sound or music in the background. First thing I do every day is I am tongue scraping. I think it's so important. We talked about how the mouth is connected to the gut. So tongue scraping is going to remove the bacteria and it's also going to stimulate your digestive process. So that's a
Mhm.
really great tool. I brush, I use an electric brush. I just switched over to a new one. I was a Sonicare girl forever,
Mhm.
but I started using one called Surrey. Actually has a UV case, which I think is so important. And so I've been using that. I switch my toothpaste up all the time because I'm always trying new things. Right now I'm using Super Teeth, but I've kind of tried them all. I
Yeah.
switch around. I'm flossing before I brush. I'm using cocoa floss every
Mhm.
day. I probably floss 3 times a day.
Wow.
Don't think you necessarily have to do that. I think if you're going to floss once a day, do it at
Mm.
night before bed.
Okay.
'Cause my morning routine's a little different than my night routine with it. I will oil pull, like I said. I'll do that 2 to 3 days a week. I might do it more frequently during, say it's around my cycle when I know my
Mhm.
gums are a little more inflamed or I'm noticing sensitivity. I use mouthwash occasionally. I don't use it every day. When I do, it's Stella Life always, or I make my own. And I just make something with distilled water. I put a little aloe juice in there. I put arginine, which is a supplement that's going to help
Mhm.
remineralize. So I just kind of make a little concoction and I'll use it, a couple times a week. We don't
Okay.
need mouthwash every day. We just want to really make sure we're removing that biofilm from our teeth. So that's my routine, of course, and then I'm hydrating all day. I'm making sure I'm getting, the fat soluble vitamins. I'm making sure to do things that are like getting sunlight in my eyes and things like that that I know are going to have an effect on both my oral health and hormones.
Yeah, I don't think people sometimes even see that connection,
Yeah.
right? Like everything that we talk about here, that I talk about here, has so many benefits. And
Right.
it's not just about optimizing your hormones. Yes,
Yeah.
that plays a role, but it also is going to affect your oral health. It's going to affect your gut health. It's going to affect your nervous system and more. So thank you. Those were amazing steps to implement. I think that's pretty doable. I don't know about the flossing 3 times a day. I definitely am guilty of not doing that enough. But yeah, the tongue scraping, we have our clients do that as well. I think it's really important. It's such a cheap tool you can buy. I love doing that. I have my partner doing that and definitely brushing. And I think electric toothbrush is the way to go as well. What is the floss that you like again? Cocoa floss?
Cocoa floss, which is
Cocoa
actually
floss.
lined with coconut oil, so it's really great
Amazing.
for the inflammation too. And I
Yeah.
know you're a matcha girl, and
Mhm.
matcha and green tea are great for oral health,
Cool.
so that's a great thing that I'm doing every morning too.
Okay. Good. Love that. Love to hear all the benefits of matcha so I can keep drinking it. Support my daily addiction. That this is amazing. So like I said, I'm gonna link to a lot of these products that Amber has mentioned because I'm sure everyone's gonna want to know where to find them. I'm also going to link to Amber's Instagram page. So you are on Naturally Amber White, correct?
Yes.
Yes. And every now and then I do share some of her posts because they're just so good. And there's one about perimenopause that I'm going to be sharing as well. And you also have a masterclass, correct, Amber? Can you talk a little bit about that and what's included?
Yes, absolutely. So it's called the Oral Wellness Reset. And so it's really just bite-sized pieces of information, things that you can implement and really transform your oral health. So I put it together. I wanted to be able to help as many people as possible. So it's linked in my Instagram page, so you can read all about it there.
Okay, I think I'm going to take that myself. Although you had a course at one point, and I think I do have it. I have to revisit it
Okay.
because all this information is just it's so amazing, but it's a lot to take in, of course, because it's a lot of unlearning as well. What we've been told over the years, you just go to your dentist, like I said, and you do what they tell you to do, and it's almost like a little too simplistic, I feel like, and there's so many different layers, obviously, when it comes to health in general. So this is incredible information. I hope that this podcast episode really opened a lot of women's eyes. I hope you check out Amber. Make sure you follow her on Instagram. She's a wealth of knowledge. And make sure you check out her masterclass because it's just so important that we have this education because I believe that then we're empowered. And the more we know, the better that we can support our health now and for the long haul. So thank you again, Amber. This was an awesome conversation. I appreciate you being here.
Thank you so much, Claudia. This was fun. Definitely anyone feel free if there's questions. I know it's a lot, a lot to navigate on your own. Of
Yeah. Thank you. All
course.
right. See you next week. Looking for an accelerated way to get support from my team? Perimenopause Made Easy is perfect for you. It's an 8-week live group coaching program with bite-sized education around the hormone changes happening in perimenopause, along with practical action steps for you to take when it comes to your diet, exercise, sleep, detoxification, hydration, nervous system, and digestion. You'll also have the option to add an HRT consultation with me if you're considering hormone replacement therapy, but you have questions, or you started hormone replacement therapy and you need help troubleshooting, or you just want more confidence so that you can better advocate for yourself with a prescribing provider. Check out the link in the show notes for all the details and to save your spot. The information provided is for educational and informational purposes only. I am not, nor do I act as a doctor or any other medical professional. I am not providing healthcare, medical services, or attempting to diagnose, treat, prevent, or cure any physical, mental, or emotional disease or condition. The information shared is not intended to be a substitute for the professional medical advice provided by your own medical or mental health provider.